Leber Congenital Amaurosis, or LCA, is a rare inherited eye disorder that primarily affects the retina, the light-sensitive tissue at the back of the eye. It's one of the most common causes of congenital blindness or severe visual impairment in infants and young children. Join us as we delve into the intricacies of LCA, exploring its causes, effects, and the ongoing efforts to improve the lives of those affected. LCA is primarily caused by genetic mutations. These mutations disrupt the normal development and function of photoreceptor cells, the cells in the retina responsible for detecting light. Over 30 different genes have been identified that LCA, with mutations in genes like RP65, C290, and IPO1 being among the most common. Because it's a genetic disorder, LCA is inherited, meaning it's passed down from parents to their children. Typically, it follows an autosomal recessive inheritance pattern, meaning both parents must carry a copy of the mutated gene for their child to be affected. Even if the parents don't have LCA themselves, they can be carriers. At its core, LCA disrupts the visual transduction pathway. This pathway involves a complex series of biochemical reactions within photoreceptor cells that convert light into electrical signals that the brain can interpret. The genetic mutations associated with LCA often interfere with key proteins involved in this pathway. For example, mutations in the RP65 gene affect an enzyme crucial for processing vitamin A, which is essential for photoreceptor function. This disruption leads to a progressive degeneration of the photoreceptor cells, ultimately resulting in severe vision loss. LCA is a rare condition affecting approximately 1 in 30,000 to 1 in 80,000 newborns worldwide. Its prevalence varies depending on the population and the specific genetic mutations present. Due to its genetic nature, LCA can affect individuals of any race or ethnicity. Because the disease is present at birth or develops shortly thereafter, it is usually diagnosed in infancy or early childhood. The signs and symptoms of LCA typically appear in infancy. The most prominent symptom is severe vision loss, often described as blindness or profound visual impairment. Infants with LCA may exhibit nystagmus, which are involuntary rapid eye movements. Another common sign is photophobia, or extreme sensitivity to light. Some children with LCA may develop cataracts or keratoconus, a progressive thinning and bulging of the cornea. Often, parents may notice that their child doesn't seem to fixate on objects or follow movements visually. Another common finding is the oculodigital sign, where the child presses or pokes at their eyes, which is thought to stimulate the retina in an attempt to gain some visual sensation. Diagnosing LCA usually involves a comprehensive eye examination by an ophthalmologist, particularly a pediatric ophthalmologist. This examination will assess visual acuity, eye movements, and the overall health of the eyes. Electroretinography, or ERG, is a crucial diagnostic test. ERG measures the electrical activity of the retina in response to light stimulation. In LCA, the ER typically shows significantly reduced or absent retinal function. Genetic testing is also essential to confirm the diagnosis and identify the specific gene mutation responsible for LCA in order to better define management and prognosis. While LCA is a broad term, it's often classified based on the underlying genetic mutation. Identifying the specific gene involved can provide insights into the severity and progression of the disease. For example, LCA caused by mutations in the RP65 gene may be enabled to gene therapy, while other genetic mutations may not yet have targeted treatments available. Therefore, genetic classification is not only important for diagnosis, but also for determining appropriate treatment strategies. Currently, there's no cure for LCA, but treatment focuses on managing the symptoms and maximizing the remaining vision. Low vision aids, such as magnifiers and assistive technology, can help individuals with LCA perform daily tasks. Occupational therapy can assist with developing adaptive strategies for living with visual impairment. Genetic counseling is important for families affected by LCA to understand the inheritance pattern and assess the risk of recurrence in future pregnancies. Excitingly, gene therapy has emerged as a promising treatment option for LCA caused by mutations in the RP65 gene. Luxturna is the first FDA-approved gene therapy for an inherited retinal disease and involves injecting a functional copy of the RPE65 gene into the retina, potentially improving vision in eligible patients. Since LCA is a genetic disorder, there is no way to prevent it directly. However, genetic counseling and carrier screening can help prospective parents understand their risk of having a child with LCA. Carrier screening involves testing individuals to see if they carry a mutated gene associated with LCA, even if they don't have the condition themselves. If both parents are carriers, they have a 25% chance of having a child with LCA with each pregnancy. This knowledge allows them to make informed decisions about family planning and explore options such as preimplantation genetic diagnosis (PGD) or prenatal testing. The prognosis for individuals with LCA varies depending on the underlying genetic mutation and the severity of the disease. In general, LCA results in significant visual impairment from early childhood, and the condition is typically progressive. However, with early intervention, low vision aids, and supportive therapies, individuals with LCA can lead fulfilling and productive lives. The advent of gene therapy for certain types of LCA has significantly improved the prognosis for those eligible for this treatment. Research into new therapies, including gene editing and stem cell therapies, is ongoing and offers hope for future treatments that may further improve the vision and quality of life for individuals with LCA.